Stephanie, and welcome everyone to our monthly webinar series here at the Institute of Coaching. I am Jeff Hull, the Director of Education and Business Development for the Institute, and as Stephanie already pointed out, I'm equally excited to have our guest speaker with us this morning. Carol is someone that I know personally, and I'm very excited to have an opportunity for us all to learn from her about the latest information with regard to taking control of your health, both from a personal vantage point, but also as a guide for us as coaches with our clients. I will encourage, as Stephanie said, encourage you all to send in questions that you might want to have answered all through the webinar. And as Stephanie said, the best way to do that is through the chat function, and send us the questions on an ongoing basis, and we will take breaks 2 or 3 times during the webinar to share some questions with Carol, and then hopefully at the end also have a few minutes to take additional questions. So we look forward to hearing from you and having a dialogue that way. So now let me introduce Carol Scott and turn it over to her. Carol is a practicing board certified emergency physician, so we have a real doctor in the house, and she is a health educator trained at Johns Hopkins University. She's also a Well Coaches certified health and wellness coach, so she works in both worlds, both as a practicing physician and as a wellness coach. She's a founding fellow with us at the Institute of Coaching Professional Association, and also recently a recipient of the Educator of the Year Award from the National Association of Women Emergency Physicians. She, as a speaker, has spoken at many major corporations, Morgan Stanley, Oracle, McDonald's, Barron's, Johnson & Johnson, just to name a few, and she's been highlighted and quoted in a number of publications, the Wall Street Journal, the Washington Post, Self, Fast Company, and O Magazine. She's also recently put out 2 books related to family health and being your full optimal self. Her book in 2015 was called Fortified Family Health, A Briefing and Guide for Women. And even more recently, a book that I'm very, very excited about. I was just in discussion with her about when she came up with this wonderful model called the CEO Model of Wellness, How S.M.A.R.T, or Smart Thinking, Can Change Your Life. And I believe that that book is now currently available on Amazon. So I'm excited to have Carol here. I look forward to having a very interesting and educational opportunity to learn from her. And with that, I want to turn it over to Carol. Hi, Carol.
Hi, Jeff. And thank you. Thank you to you and to Stephanie and the Institute of Coaching. It's always a privilege and an honor to be affiliated and, more importantly, to be considered someone among my colleagues to have the opportunity to share some information. The plan for today really is to frame some issues around health and wellness that, as you said, Jeff, can be used for ourselves and for our clients. I am not a performance coach, as Jeff mentioned. I coach wellness and advocacy and consult with executives and their families. So what I thought I'd do today was to, as we do in the coaching world, align myself with you and perhaps motivate you to consider your health and wellness from a fresh perspective. There'll be 3 segments for this presentation. First, some background information to give us context for ourselves as entrepreneurs and business people, and leaders, the leaders that we coach, entrepreneurs, executives. Second, we'll look at 2 strategies or tools that I've developed over the years which have been effective in my coaching practice, just to share that information with you. Perhaps it will be helpful for you, yourself, or for your clients. And then third, we're going to talk about some specific need-to-know information, things that I think that you and your clients need to know for 2016 to make sure that you can be your best self and in terms of your personal life and your professional life. We'll have ample opportunity for questions, as Jeff said. And Jeff, please, I do invite you to, at a point at which you think it would be helpful to interject or provide an answer immediately, to indicate that to me. Otherwise, at the end of each of these segments, if you would be kind enough, maybe we can answer questions. How does that sound to you, Jeff?
That sounds great.
Okay. So, and also I should just say that I am available offline for follow-up if you have any questions or clarification, and or if you want more information. So here we go. I think we're going to start by thinking about someone who arguably is probably one of the leading and most successful entrepreneurs, executives who's ever lived on the planet, and that's Steve Jobs. And we know that Steve Jobs, there are a couple of films that are out about him now, about his life. He was able to persuade just about anyone, from Apple engineers, potential investors, to believe in his vision for the future. It actually was often said that he surrounded himself in a reality distortion field. And that term came from one of his employees at the Apple Computer Company in the mid-1990s. And he was a Trekkie from Star Trek. And apparently there was an episode where the crew of the Starship Enterprise visited a unique universe where the aliens were able to create a new world for themselves by thought alone. Consider that. Thought alone. These worlds originated in their minds but manifested themselves as real physical worlds. And it was often said that Steve Jobs had this ability. He could convince people of the value of all of his new products, regardless of the challenges, the shortfalls that fell in his way. And he, in fact, lived in this reality distortion field. More than once, he's transformed our society. But in 2003, I should say, his world changed. He was given a diagnosis of pancreatic cancer. It was an exocrine gland cancer, which is not the pancreatic adenocarcinoma that many of us are familiar with, unfortunately, with colleagues, friends, or loved ones. But we all have our own beliefs. And Steve Jobs, in his distortion field, perhaps decided that his approach to his cancer would be different. That in fact, he is a high-achieving person who had control of his world. He, with the diagnosis of a neuroendocrine tumor, which is potentially curable, chose not to have traditional treatment. Now, mind you, I am definitely an advocate of, and in fact a consumer myself, of some alternative and complementary modes of medicine. However, there are some situations where, as we'll get to when talking about smart thinking, we need to very carefully consider the opinions of experts. He chose not to have the cancer excised at the point when it was localized. Now, mind you, I am not his provider. I have not seen, obviously, I have not seen his medical records, but I'm just sharing this to give us context on this. So let's just say that he was in a medical reality distortion field, which kept him from doing what he ultimately did, which was to have chemotherapy and to have surgery. But ultimately, he did, in fact, succumb to this horrific disease, which potentially could have been curable. So I would ask you, where are we? Where are you? Where are your clients in terms of they're feeling good about, and understandably so, with the performance that they're achieving and the goals that they're meeting? And it's not just about Steve Jobs. There was an article that was written by a professor at at Stanford University. His name is Buranashki Borkovich, and he published in 2006 and in 2012 an article where he looked at the common causes of deaths of CEOs. Now, he did it in the context of looking at the importance of having a board in the event of a death of a CEO. Look at this, 39% heart attacks, 28% sudden death. Only 16% had a brief illness, 30% cancer, 12% prolonged illnesses, and then a very small percentage had post-op complications. And interestingly, heart disease, coronary disease, and cancer are the #1 and #2 causes of death for men and women in the United States and many other nations. Again, we're looking at, I am trying to advance the slide, which is not happening, but I'm sure I can make this work. And again, this is not just about Steve Jobs. Jim Catalupo came out of retirement to revitalize McDonald's back in the early 2000s, and he turned it around. He introduced salads, he introduced apples instead of with the kids' meals and so on. He turned the company around, and in fact, he succumbed to a lethal heart attack at the age of 60. What about Jai Nagarkati, the CEO of Sigma Aldrich? He, in fact, succumbed to a lethal heart attack at the age of 63. And then we recently knew about James Lee Jr., J.P. Morgan Chase, again, lethal heart attack at age 62. And Stefan Jacoby, who was with Volvo, he had a stroke at age 54. and that is, I should say, on the spectrum of heart disease. So, and then there's also Aaron Schwartz. For those of you who are familiar with Reddit and Creative Commons, these are one of the newer breeds, the millennials, who are entrepreneurs and leaders, and many of you may be coaching them. Aaron Schwartz, very sadly, had depression, and after undergoing a very difficult and challenging legal fight, he committed suicide. So I would say to you, just reading his words, perhaps you cry, you feel worthless. Depressed mood is like that goes on forever and doesn't come for any reason. It doesn't go for any either. And if I should say to you that I'm not able to see my full screen, so I'm having difficulty with reading some of this, but I will adjust this. So then the question then begs, what about these people that we coach, the people who some of us are? Are entrepreneurs touched with fire? You know, the question is, do we in fact, who in their right mind would be an entrepreneur? You know, you have lots of barriers, you have to work hard, and you really have to be a very risky person, someone who will take risks. So the question of all of this was studied in a recent study that I think is very, very helpful for us to think about just for a second. Because entrepreneurs, they create jobs, economies, they give us new products and services. So we really need to understand this. Some of the mission critical, I guess we could say, propensities or traits that entrepreneurs have are also clinical features of bipolar disease, depression, ADHD, and substance abuse. And for those of you who are coaches, who work with clients who are entrepreneurs, this is no surprise to you. In fact, in this study, which looked specifically at a control group and a group of entrepreneurs, respondents had said that they had had any lifetime mental health condition, including those that I mentioned, 49% among entrepreneurs, as opposed to 32% as a part of a matched control group. And again, the reference is there for your consideration. What about the lifetime prevalence, the lifetime occurrence of a mental health condition? And they are very specific here. Depression, 30%. If you look at the lower part of these bar graphs, I am looking at E, which are the entrepreneurs, and C, the control group. The lower part, the darkest blue, reflects the percentage that was determined in these self-reports in this study. 30% depression, almost 30% ADHD. Anxiety, interestingly enough, in both the entrepreneurs and the controls, and then substance abuse, 12 and 4 as noted, and then bipolar disorder in 11%. And then finally, there was an occurrence of more than one mental condition. I won't go through the detail of that, but again, very high in entrepreneurs. And finally, what about first-degree relatives? What about the genetic component? And just look at what's in the red. Among entrepreneurs, 72% of entrepreneurs are directly or indirectly affected by mental health conditions. And that is symptomatic family members as opposed to 48% in those control group. So having gone through this, it's really also interesting to realize that when we coach, as I do, an executive, I coach families. And part of our approach that we're going to talk about today is the fact that we can fortify ourselves and become healthy, and then we will then be able to share that with our families. Family, if you want to call that, for your colleagues at work, if you're a leader, but also for your personal family members. And there's a syndrome, Stanford University, that was written about called the Stanford Duck Syndrome. So we're also seeing that there's pressure at an early age that oftentimes some of these driven entrepreneurs and leaders are giving to their kids. And this has led to a rash of suicides in Silicon Valley, something that was written about in the Atlantic magazine not long ago. So having said that, what can we do? What does this mean for us? Well, hopefully this frames the discussion. We're going to talk about heart disease, we're going to talk about strokes, we're going to talk about a little bit about depression. And for one thing that I want to just share with you, right, which just came out this week, January the 26th, the U.S. Preventive Services Task Force recommendation statement about how we meaning society in the United States, should go about screening for depression. And one thing that I want you to know is we, in fact, should be thinking about and considering if there are signs or signals. And oftentimes there are no signs and signals, but as coaches, oftentimes we have that underlying intuition. That's why we're in this business. So I would invite you to think about, asking a client if they have spoken to their primary care doctor. Now, one thing is very important. If you open Pandora's box, you must have a system or a process in mind to ensure that someone is safe. At a minimum, there's an 800 number available everywhere for help if you feel someone is at risk of harming themselves or others. But here's the nugget from this. I want us to be thinking about mood disorders and depression in our clients and helping them think about it. And then what about women? All of that really focused on a lot of guys, but there are issues for women too. We have different experiences of our careers. We have more collaborative leadership styles. We really invite and become mentors and mentees in a way that's a little more significant for our career trajectories than men. We have careers that are not disrupted, something that was ascribed to this out-of-date concept, or at least a concept that the literature really fails to support, that there is truly a work-life balance, because there is no difference between work and life in a way of thinking of a balanced fulcrum, but rather there are different things and different priorities at different points in our lives. So it's a non-linear career often. We value authentic relationships and connectedness more often than men, according to the literature, and we focus on caring. Focus on others, caring and overcaring, even in situations where that decision making might make a difference for the performance of a company. And then we live in gendered societies. Often women, we are more perfectionists. And then there are the myths of overcommitment, the myths of not being able to say no and not keeping those boundaries established. We also know that women leaders and at work experience stress a little differently than men do. And that's really important because, as we'll get to later when we talk specifically about some of the disease concepts, heart disease stress is an independent risk factor. We'll talk about it more, but just as most of you are aware of the risk factors of obesity, smoking, abnormal lipids, stress is now a verified risk factor. And for women, there's the paradox of a high job satisfaction and high levels of stress. The fact that often women are alone at the top, that there are micro inequities, that personal relationships, as in men and women, can be strained, and then there's role conflict, because despite the fact of changing with younger generations and how people divide the workload in couples that are together in a household raising a child, it would appear that women still have that double duty. And then there's the influence of hormonal changes, and we have various coping styles that men don't, and our energy demands and maintenance, those issues are much more specific and are unique for women. Now, I also, if you'll notice, have this Time magazine, because I think it's important to say, despite all of that, we are successful, women can be successful, men can be successful, and this is not about what are our differences, it's more what are our commonalities. For you as a coach, I'm giving you information hopefully that will help you in thinking about the coaches that you have, the clients that you have. We're talking about balance for women, including values, roads, rewards, stress, relaxation. And one of the ways that obviously I go about looking at things because of being a scientist is to take a look at data and information. So I had the privilege to work with a multinational IT company recently. This is a company with the stats that you see there, $38.2 billion in GAF revenue in the year 2015. They had a global women's leadership conference where I was privileged to be a keynote speaker. And one of the things that I stated to them when taking the invitation on, I said, I really want to get a better understanding of your people, because these are awesome women who are really movers and shakers. They brought in their top 250 women leaders from all over the globe. 105, which is a pretty good response rate, responded to the survey. And I'll just share some of this information with you as insight as we conclude setting the context for this discussion this morning. This will be, and then we'll take some questions. So we asked what were your jobs, and you can see that most of them were managers. However, they brought in all of their people, their engineers, marketing people, and asking what were their age. Most of them were in the age group of 50 to 59, which goes along with statistics on when women are at that leadership at that point in their career. We know that when we ask people about their health, one of the greatest predictors of how healthy you are in terms of objective measures, meaning your blood pressure, your diseases that you might have, is your perception of it. So I asked them that. Only 14% thought they were in excellent health, but fortunately 48% said that they thought they had very good health. I'm trying to move this forward. And then I asked specific questions about how they felt about themselves and what they were experiencing. 50% said they worried about their health. 15% were not satisfied with their personal physician, and 30% were not up to date on their preventive health screenings. That to me was so important because these are women who have access. They have the economic wherewithal, obviously, but why are they worried about their health? I would say to you, some of your clients are worried about their health, and that may in fact affect their performance. Just something to keep in mind. 3 more slides in this series. Then I asked them, do you have a specific diagnosis, a health problem that you were diagnosed with? 50% were told that they were overweight, 45% were told that they had abnormal lipids, 13% depression, 13% high blood pressure, and 3% had diabetes. I think that's significant information and certainly something that you might want to consider in working with your clients. I ask about some emotional issues. Are you happy? Are you content? Are you not happy? Or are you depressed? The good news there is most of our participants were in fact happy and content. What about energy? Because energy at the end of the day is really what most of us, and I certainly know for me personally, becomes an issue oftentimes. And again, good news. Almost 80% stated that they were very energetic and capable of doing what they wanted to do or needed to do. Finally, sleep. I asked the question, do you get the sleep that you need? And the recommendations are, of course, for 6 or 8 hours, and we're almost genetically wired for how much sleep we need. We can't take care of sleep as a sleep deficit. We must do it in an ongoing way. And again, I think pretty good news. Only 20% of our respondents had, actually almost 30% had difficulty with sleep or did not get the amount of sleep that we thought would be, the literature would suggest was best for recharging your brain, giving you the hormonal and hormonal boost that you need from actually allowing your brain to rest and rejuvenate and retain memory. And then finally, I said finally before, but this is really it. In the last 6 months, how satisfied have you been with certain aspects of your life? And if you'll notice, they were satisfied with their family, 73%, and with the types of foods that they eat and how they eat, and personal grooming, which of course is part of maintaining that professionalism. So let's move on. Again, heart disease is at the core of my concern for all of us because it is the #1 cause of death. 1 in 4 people in the United States dies of heart disease. And unless you're doing something to make a difference, it will affect each and every one of you and us. There are some differences that I'll bring up in terms of just heart disease and men and women. Again, information for you personally and for your clients. This is a graph that just displays, here's the sum of this. Deaths in the hospital when a patient has a heart attack. The mortality rate for women is 17%, and it's highest in those under age 50 when a young person has a heart attack. If you look at the far left side of that curve, less than 50 years old. And it less so in older age, but that is huge. Not only that, but women receive less cholesterol screening. These are studies that are published, evidence-based information. They have less lipid-lowering therapies, less often on statins. Now, mind you, this is a study. This is not the specifics. Each person must talk to their doctor. And obviously, that's without needing to be stated. Also, after a heart attack, women have a 2 times the mortality rate, death rate, after having a heart attack when compared to men of the same age. 38% of women die within the first year of a heart attack versus 25% for men. And then more women rather than men have a heart attack within the first 6 years of having had that first heart attack. And then finally, higher rates of depression, physical disability, and reduced functioning. So there. What I tried to do was give us context to say that we are all human, that there is something that is different about leaders, that there is a predominance of heart attacks, strokes, and cancer, that perhaps we can think about differently if we have, and depression, mental illness, that may in fact be a part of what allows our clients and ourselves to be successful, But now what can we do about this? How can we take control of this and make a difference for ourselves? And with that, I'll just stop for a moment and see if there are any questions. Jeff?
Yes, take a little bit of a breath for yourself,
Okay.
Carol. Step back, have a little sip of water. You're on a roll there, and it's amazingly interesting information. There are just a couple questions coming in, so really just a quick sort of maybe closure on that section. A
Okay.
couple folks asking for some clarity. So you shared some data around entrepreneurs, but before that you also showed some data on CEOs. And so just some clarity. Does the data with regard to health outcomes and death situations for CEOs, does that match entrepreneurs, or is there a difference?
Good question. I don't have the data for that because these were two very separate, very different studies that were done in completely different contexts. Again,
Okay.
the Borokovich study was really looking at, the name of the study was The Importance of Board Quality in the Event of a CEO Death in the Financial Review. And he really just looked at the numbers of deaths and the causes of death. And I should say that the umbrella for all of this are the statistics on causes of death by age and gender that are reported by the government and the CDC. And I chose not to put those in here but there is some correlation there as well. So I
Would
would,
you personally say that there's probably a similarity though in terms of some of those higher numbers showing up in entrepreneurs, showing up in the CEO population in general?
I don't see why it wouldn't be, given the
Right.
fact that there are some other traits, personality traits and lifestyle concerns and stress that might be present. Absolutely. Yes, Jeff.
And then the other question is, you spent quite a bit of time on women, and and maybe you don't have a research number on this, but anecdotally, do you find that women, when they get to leadership roles all the way up to the CEO, that their health statistics start to veer more towards the severity of the men, or is there any correlation in terms of women in leadership roles?
Well, that study has not been done. That's a study that I've been wanting to do.
Yeah.
But I think that the unifying factor is stress. And
Mhm.
one might also say that a unifying factor is the concept of a type A personality. And the type A personality was really described by a guy named Meyer Friedman in UCSF back in the 50s. He and his colleague, the cardiologist, an upholsterer came in and noticed that their chairs were worn at the ends of the seat. And the upholsterers brought it up to the Dr. Friedman, and they subsequently conducted a study, and then this has been looked at over the years. They defined the term type A personality trait. Fast forward, after the 60s when they first published their seminal article in JAMA, fast forward after about 25 years, we now know that hostility is the actual lethal factor in type A personality disorder, because it's characterized, there are a number of constructs that are associated with that definition, but we know that one is a sense of hurriedness, a time pressure. And everyone thought that it was about the time pressure and the time pressure. Time pressure is a part of it, but now we know that hostility and anger. And I would say to you, now you're asking me anecdotally, you're putting me on the spot, Jeff, but I would say that women tend to be less hostile and less angry. Now, I know somebody may argue with me about that or choose to differ, but given that, and of course the effect of that hostility, having heart attacks and strokes after an episode, an outburst of anger and hostility, that effect in terms of the biochemistry of your body, that lasts for several hours, 4 to 6 hours.
Mm.
So just an interesting thought.
Yeah. And then the final question that we got so far is very specific, which is Kimberly Shookman is looking to find out how to get the 800 number for folks if she does come across someone who seems to be in a severe situation with regard to potential mood disorder or harming themselves.
Absolutely, absolutely. Well, there are two things to that. One, I will find it. I'll just have to Google and get it for you while
Okay.
we're on this call. But also, I would defer to you, Jeff. You are a PhD psychologist, counselor, and I know that I have mentioned clients to you, and that is your expertise. So I think that within the Institute, just speaking with us as a cohort, as a group, I think we have some internal resources, someone that, and I certainly think, schedule aside, you'd be open to hearing about or giving advice to someone? Yes, no?
Yeah, absolutely. I mean, I think that the Institute can be a resource for that. And the only thing I would add to that, though, maybe more specifically, is that as a coach, especially if you're in a leadership coach or a wellness coach situation, I would always recommend that you have a colleague who's a licensed psychotherapist or a licensed clinical psychologist that you work with, so that if you intuitively pick up on signals
Mm-hmm.
that you feel it's not appropriate to necessarily bring to the client or to do some kind of screening, but you have a colleague that you can share that with and get their advice and potentially make a referral.
I like that. That sounds very good. That sounds very good. And then your information is available for everybody, so I'm sure you know people all over the country and you can help direct us as well. Shall we move on?
Yes,
All right.
go
So
ahead.
now we're at this second segment where we're going to really talk about, having set the context for this, what can we do? How can we redefine personal wellness? And there are many wellness wills. You may have studied this somewhere along the way in a college health class, intellectual, environmental, occupational. We don't need to go through that, but there are elements of wellness that are defined. What I wanted to share with you, though, is the fact that let's take this to another level. When we think about wellness, we know that World Health Organization has now said that being well is, and being healthy is more than just the absence of a disease, because you can be a well person and live a healthy life and have a healthy lifestyle even though you have a chronic disorder. And that's one of the things as an ER doc. I still practice clinically. People come in and they're expecting to be broken down. They're anticipating having a problem because they have diabetes or because they've had a cancer diagnosis and they're a survivor, or because they have high blood pressure. Not so. Look at this. The determinants of health, and this is from Health Affairs, the journal. Although your genetics, 30%, and now we know, of course, that we can modify those genetic impacts as well. 40%, the largest determinant of healthcare, is lifestyle. And that's so important. In fact, we know there was a study from Harvard, the preventable causes of death in the United States, comparative risk assessment of dietary, lifestyle, and metabolic risk factors. There are 12 modifiable lifestyle factors, and we know that in the United States, almost all 2 risk factors were accountable for each of 1 in 5 deaths in the United States, 20%. And that's huge. Obesity, 1 in 10 deaths were due to these preventable causes of death, all relating to lifestyle issues. Now, in the area of business, Tom Rath wrote a book called Well-Being, and actually began to look at well-being in leaders several years ago. He published this, and he had 5 dimensions of well-being for a leader. And then even the Harvard Business Review has looked at it. They've looked at the economics of well-being in this issue that came out in 2012. And what they specifically said was, it's not the gross national product, and it doesn't take rocket science to figure that out. It's more about happiness. It's how do you live your life? It's actually the life in your years and not the years in your life. In fact, what this shows, and this is something that was described, and I apologize, I can't give you the name of the author of this article, but this was described about 10 years ago. If you were to graph your life, and if you look at the bottom, the x-axis, birth to death, left to right, from bottom to top, the quality of your life, think about it. Most of us live on this red line, where we're actually having a decline from birth. We're doing well, quality of life and health, and it declines slowly until death. And in fact, we know from an economic standpoint, job standpoint, that most resources go into an individual in their last 2 to 3 years of life. What if instead of that, look at that green lime line at the top. What if you were to square the curve, which is what this is called, squaring the curve? What if you were to live well, have great quality of life, until suddenly you were to succumb and you were to die? That, I would say to you, would be what you and I, and for our clients, we'd like. We'd like to have a life well lived. And the U.S. Trust published a document, and they're a branch of Bank of America, a document that I thought was very helpful. They actually looked at the annual survey of ultra high net worth and high net worth Americans. And again, not all of our clients, nor are we necessarily of high net worth or ultra high net worth, but this I think is very interesting. I want you to get the concept that you can, for yourself and for your clients, think about health as your greatest asset when we think of wealth. And in fact, their clients did. Financial security, look at the top green little shapes. The essential elements were financial security, health, and family, and there were other elements. And 99% of the clients thought that health was as important or more important than wealth. Further, they looked at this by generation groups, and I think this is really important because millennials, meaningful work was number one. For Gen Xers, financial security, and baby boomers, health, and maturers, health. So this doesn't surprise any of us, I don't think. Financial security probably is lower, third for baby boomers and maturers because most of that's in order at that point in life. But I think that that's interesting. For millennials to think that health is not important, I think we need to look at that because the habits that we acquire as youth are really going to be important. I'm calling youth meaning millennials in their 30s. So how can we and our clients set and achieve the wellness goals that we want? How can we rethink this? What can you do? And how do you get there? This is one tool that I want to share with you that I think can take us in the right direction. It's the CEO model of wellness. The concept here is simple. If you are the CEO of your health and wellness, you are responsible for establishing the vision, the purpose, and the strategic direction of managing your body. And we're not talking about a startup here. You're not talking about a business that you're going to flip and reap benefits from and then just cash out. We're talking about a sustained business, one that you want to give you dividends every day. Think about it. Your doctor is just your COO operationalizing your vision. You must have clarity about that. And in this model, I've described 4 steps for doing this. First, developing a vision, having a strategy, and of course, having a leadership team and being accountable. They're not necessarily sequential because, in fact, the leadership team would be established before the strategy is completely put in place. And there are 4 principles: growth, innovation, crisis management, and risk management. And again, the book that Jeff mentioned to you really goes into detail. I just have a couple concepts here that I want to share with you and see if we can engage in a conversation to see if this has some validity to you. So let's think about it like this. A business faces internal threats, employees, management, lack of vision, external threats from market forces, government, taxes, and as an individual, we face internal threats. High blood pressure, the culmination of lifestyle decisions, external threats from the environment, there are microbes internally that affect us as well. So I hope that resonates with you as a way of thinking that you can take control of this. And if you say, I'm not up for it, or your client says that they're not up for it, there was an article about the best performing CEOs. And 3 concepts from this article apply to the concept of you being your own CEO. One is that insiders do a better job in turning a company around. So don't think you can't do it and that someone else out there is the expert on you. As coaches, we often say that our clients are the experts on them and we have to help them better understand it. We hold up that mirror, we provide reflections. Same thing here. You can be the CEO of your own wellness. You're the best person. Number 2 concept from this article. The lower achieving, the lower functioning and performing the company was, the better the turnaround is. So again, for your client, oh, I'm overweight, I don't like this, doesn't matter. In fact, if you're at a point where you need more assistance, where you're not where you want to be, you're more likely to be successful. And then finally, the 3rd point is that you know yourself best and will leave a legacy. So if someone is able to, the best performing CEOs were those that had in mind the idea of having a legacy. And I would submit to you that each of us who has family members, who has aunts, mothers, sisters, children, you want to leave that legacy. And those that performed best had a legacy that sustained the performance of that organization for at least 3 years. So you're the best person for that. So let's just very quickly just run through these three. And again, well beyond the scope of this particular discussion to talk about this in detail. I give workshops on this, but let's talk about these three pillars. Growth. You're going to practice sustaining and health promoting and enhancing behaviors on a day-to-day basis. And again, what those are, we'll talk about in a moment. Innovation is the idea of executing intentional disruptive change for yourself, for health and wellness, for yourself. The fact that if you hear about a new strategy or you hear about a new approach or a technology that you might use, not saying, oh, I don't want to do it, I don't know how to do it, engage in it, jump in with it, find a group of people that you can partner with to do it. Crisis management is the next concept, is to be able to recognize, respond, and recover from potential or real threats in your well-being. And again, in the book, what I describe is I give business models, like I use the model of the Toyota when they had the debacle. I guess now you could even use Volvo, the way they misrepresent it. But when there is a crisis, how do you manage it? You have to acknowledge it. You have to understand it, and you have to respond and then recover and make sure that it never, ever happens again. We give specific examples of how to think about that in terms of crisis management for your health. And then risk management. We have to challenge assumptions. We have to mitigate and manage health through prevention, moderation, and compliance. One example here is the idea of, which is very well known now, of course, is doing a genomic assessment. Have you ever had that conversation with your family members or with your CEO if they know that there is an ongoing chronic medical condition that can be particularly debilitating or life-threatening even? Has anyone decided or thought about doing something about it, doing something different? So again, not something to be taken lightly. I would not make a recommendation to a client to go out and do it. I would say have that conversation with your doctor. So if you get any data, you have to understand what you're going to do with that data. Otherwise, you don't want to obtain the data. So the second construct, second tool that I want to share with you is high reliability science. I am just so excited about this. CEO model of wellness I developed within maybe 5 years ago, and I've written about it. But this is just so important, I think, that I've added to the model, but independently is, I think, an amazing tool that can be used. So the question I'd ask you, what do you call an organization or an industry that's complex and risky but very safe? The term for that is a high reliability organization. And in fact, high reliability organizations, look at the bottom of this slide, the goal is to have zero preventable harmful events. You have to have an organization where people communicate openly. And look at the bottom, the last bullet. These organizations say, what happens when a system fails, not what if the system fails. Now let's think about that. We just talked about your body as a business. Our body is a complex organization. We're not Fukushima that had the nuclear plant accident, but we are a complex organization. And in fact, the study of that disaster with high reliability science has taken leaps and bounds in terms of the security of nuclear plants now. In fact, the ratio of accidents per reactor hours now has decreased exponentially with high reliability science. And the principles of high reliability science, I think, can be applied to any organization, including the organization of our own body. Healthcare organizations have adopted high reliability science benchmark organizations within about the last 7 years. Here are the 5 principles. 1, preoccupation with failure. I'll go into detail in just a moment, but let me introduce them. 2, reluctance to simplify. 3, sensitivity to operations. 4, commitment to resilience. 5, deference to expertise. So if you think about it, look on this graphic, the average rate per exposure of a catastrophe. In other words, associated deaths per activity or reliability. Very unsafe, far left, ultra safe on the right. Look at that. Commercial, large jet aviation, railways, nuclear industry, very safe. But cardiac surgery for patients who are sick, if you look on the left, the second box down on the left, that is unsafe. So what I want us to do with smart thinking, which I'll explain now, we can get ourselves to the right side of this curve and be safe. We don't want to have a risk that would be We want to have zero preventable harmful events. And again, high reliability science benchmark organizations, patients were having the wrong leg amputated, or patients were getting the wrong medications. So, the final 4 images in this segment. I want you to think about SMART thinking. I have applied those 5 principles to a model that can be quickly and easily and efficiently used by us. Self-awareness, monitoring, advocacy, resilience, and taking action. And here's what that looks like in action. Self-awareness, scanning with vigilance for risk. It's just adopting a mindset that you're not invincible. Patients come into the emergency room and they don't know how they had a heart attack, and they're obese and they're eating out of a bag of potato chips and I'm eating French fries, and you're saying being aware, scanning for vigilance. Again, this is that knowing that there is a preoccupation with failure. You're a complex being. You're likely to fail. So success breeds confidence in a single way of doing things and generates complacency. You might have a client say, or you would say, well, my father lived to be 96 without any problems, so why should I unchange my unhealthy lifestyle? Again, just an example. High reliability organizations preoccupied with failure. Monitoring, knowing that small little ripples in the water, a stone, if something happens, what we don't want to do is the second principle. We don't want to simplify interpretations of why it happened. Oh, it just happened. I was feeling tired that day. I had that discomfort in my chest. Can't tell you how many people come in the emergency room and they have huge STEMI loss, a lot of their mass of their heart, where if they had come in, gotten to the cath lab, and gotten stented perhaps 2 days when it first started, they wouldn't have such a dire consequence, that mortality that we spoke of. And by the way, one of the reasons that we know women come in and have poorer outcomes is because they show up later, because they're caring for other people. They would take their son in, their daughter in, their cousin, their sister, but they don't take themselves in when they have a problem. Again, look beyond the obvious, and we're thinking about not simplifying explanations. Being sensitive to operations is also a part of monitoring. Again, knowing what's going on and making adjustments. Advocacy relates to the deference to expertise. And I would say that each person that you work with who is a client, they have the capacity to be an expert about a particular disorder that they have, about diabetes. You know, there's so much information on the web now. Not all of it's accurate, but talk with your doctor. You have your client. Use advocates if you need to. Make sure that you get the expertise that you need for getting your care. And then having resilience. Resilience, of course, is realizing that you may have malignancy or cancer, but when you no longer have that, learning from that and ensuring that that is not a problem for you again. Resilience in general is the capacity to detect, contain, and bounce back. Okay? So making sure that you work with your doctor. I can't tell you again, seeing patients. Somebody will come in and they'll have a blood pressure of 145/80. And they'll say, oh, that's fine. My doctor said it was fine. It's always that. That's the way I run. But again, if you educate yourself, 140/80 is not a good blood pressure. It's something that you need to understand, to take the time to make sure that you are getting the care that you need and that you're doing it in an ongoing way. Finally, taking action. And I just use this to create a mnemonic SMART. So I'm saying these 5 processes produce a state of collective mindfulness. And that's the term, if you read the articles about high reliability organizations, they create a culture of safety and mindfulness. This is a whole new way to think about mindfulness. It's not just the focused, in-the-moment thinking that we need to allow our brains to rejuvenate themselves, but we're talking about being mindful about your entire existence. So there you have it. What I wanted to do there was to share with you these 2 tools, the CEO model of wellness and the SMART thinking for taking control of your health and wellness. And the final segment that we have is to really talk about some of the specific issues that may be of concern, and we have maybe enough time for questions now, and then we'll move on to specific disease entities and need to know things to do to make yourself healthier and better. Jeff?
Sounds good. I'm like the edge of my seat here. It's great. So yeah, take a quick breath and a sip of water for
Thank
yourself,
you.
Carol. And the questions that are coming up, Mary Beth Bloser, one of the folks that's on the line, is asking a really good question. And Mary Beth, I had the same thought in the back of my mind. So, and a couple people are asking these kinds of questions. If you could just take a couple minutes, Carol, and maybe you're going to get into this, but to think about when you have this framework with your clients and they are not motivated to do anything about it. So not motivated to see a doctor, don't think it's necessary, I feel fine. I, for example, have a client, I mean, these kind of weird juxtapositions, right, where you have on the one hand a client who's very healthy or appears very healthy but hasn't seen a dentist, for example, in 5 years.
Hmm.
And says, oh, well, I brush my teeth every day, so going to the dentist is really a waste of time. And so I'm just curious as a coach, so you've been putting your medical hat on. Now for a couple minutes, maybe put your coach hat on and help us with how do you motivate people to use this framework and to see doctors, to move into that growth mode. What are some of your techniques?
Okay, certainly. Well, first I need to acknowledge that I am a certified wellness coach through Well Coaches, and that is a organization that is, I think the correct way to say it would be is in partnership with the Institute of Coaching.
Sure.
Meg Moore, Coach Meg, I truly admire her. She is the person who helped me achieve just greater heights and levels of understanding of how to do that motivation. And I think that the key is not how do I motivate them, how do I determine what's in it for them, what's the skin in the game for them, what is it that they want to see or do, what do they want to experience. My understanding in Google is that mindfulness was a strategy that they wanted to bring to the table. So they brought Thich Nhat Hanh, who of course is a guru in mindfulness, brought him out to their campus. And what they had all the employees do, as I understand it, I've not seen it, is to write on a big board that was out there, what did they want to do 10 years from now that they wanted to do with the health that would allow them to do it. So in other words, the traditional answer would be something, I want to dance at my granddaughter's wedding. As trite as that might sound, that's the type of thing for your client. What is that issue that makes a difference for them? And I think that the skill of being a wellness coach in part, and same skill that you can apply, which is why we're having this conversation among all of us as coaches today, is that's the core. And I would ask you to just think about the same strategies that you use to get to what is that factor. Why does someone want to stay in the position that they're in? Do they want to transition to another company? Do they want to stay? Do they have a concern within their organization? It's that same type of thinking. On a more practical level, I would say that it's small bites, just in terms of actual things you can do today. It's not biting off the whole thing. Say they don't see the doctor, they don't see the dentist. Okay, that's fine. Let's not even go there because that requires getting the insurance papers out, making a phone call, making an appointment. Just take little tiny baby steps. Small successes work. So again, get them to make that vision, and you can do this. What would it look like to you? What would it feel like for you if you were at your optimal level of health and wellness? Just ask a client that. What would it look like? Close your eyes. Paint a
Right.
picture for me. Paint it for yourself. Number two, then once they come up with something, what's keeping you from doing that? That's not exactly the language to use, but what would it take for you to do that? How confident are you that you could do this? Is this something you really want to do? What does it take to get to that? And then have them brainstorm. Many people there's that inertia because you don't know where to start. So then you have them do an exercise where you just say, okay, you have a magic genie bottle. If you have 3 wishes, what are those wishes about what you could do today? Just let them fantasize and think about it and then help them shape that as you do in any other accountability mode as a coach into something to make them do something different. And then finally, rewards. They need inherent rewards. So we all need inherent rewards, right? What is it that you're going to do not 6 months from now when you lose X amount of weight, not 5 months from now when you adopt a plant-based diet, but what are you going to do? What are the process outcomes that you can identify that they buy into, that they can celebrate, and that they can celebrate? And then I guess I'll mention one more thing, because we could talk about this, and
Right.
that is integrating anything that has to do with your healthy lifestyle. I talked about lifestyle modification. For those of you who are abroad, smoking and lung cancer and respiratory problems are way up there. They're up there in Europe, along with, because smoking is still much more prevalent. They're right up there with heart disease, but just primary respiratory problems, COPD and emphysema. So if somebody wants to, I'm using that as an example because of smoking. So again, what is it that, how can you integrate this into your day-to-day life, a strategy? And again, we all know the old notion of, if you're around people who smoke, you're going to smoke. If you want to get more walking in, get a device, hold yourself accountable. I have a Fitbit's charge now, and I love it. At the end of the week, colleagues, people that I haven't talked to for years, we're looking at how many steps we're doing, things like that. Is that helpful, or is that too much, too little?
No, I think that's great. I think you're keying in on some of the absolutely crucial factors in trying to motivate someone. And I would just add that for anyone out there who's thinking around these same kinds of issues or questions, on the Institute website, there are a couple of master classes related to motivational interviewing, and that,
Yes.
as a resource, could be very helpful because it's basically the way you frame, right, the
Right.
questions.
Right. And you
And
frame the question so that ultimately the client makes the statement about what they
exactly,
want to change. And
right.
if they state it themselves, they will then, aha, I came up. And in part, that's a part of what being the CEO of your own health and wellness is. You can just break that down, and those 4 pillars really allows you. So if you want to think about something you want to do in the area of innovation, then you could get them to say, well, I've thought about that, but I have not really done it. I don't have the time. I want to go to the Apple store. I don't want to do all of that. But then you can allow them to realize, well, you pick a strategy. Well, how do you want to implement what you just stated you wanted? You want to work out more. You want to, but yeah, there you go.
Yeah,
I,
it's
I
great.
agree. Shall we move
Thank
on?
you. Yes.
Okay, so we're going to now talk about some specific disease entities. I just show you this because aging is something that, if you noticed, a lot of those people who were CEOs, they were older. The women that I spoke with were women who are becoming, as we all are, consider the alternative. It's a good thing. But I want you to get this concept in mind. We all start out with risk factors. Then we have a disease. Then we can become impaired, disabled, or dependent. That spiral doesn't have to happen, though. So I want you to think about how old are you really. This is just a simple way to think about it. You have a chronologic age, realage.com. There's a website. I invite you to go to that. I think that's something that's data, because people are entrepreneurs, speaking back to what we were referring back to what we were talking about a moment ago, Jeff, because entrepreneurs, business people love data, information. That's real data. Let them look at that. And then I want to talk just for a moment about something that you can do that could make a huge difference in your life. Telomeres. I'm sure most people now are familiar with the concept that we have chromosomes, and at the ends of them, think about these as the ends of your shoestrings, the plastic. Kids don't even have shoestrings like they used to, but there are still some tennis shoes that have the shoestring, the plastic. They are at the end. Those are what are called telomeres. Telomeres are a key function in aging and our health and wellness. So telomeres telomeres shorten with age. So every time, think about, don't worry about this slide other than to say what causes aging. We're going to focus on one thing that causes it. Cells are programmed to die because they replicate, they go over and over, they produce themselves, reproduce themselves. They have to, because our cells are constantly turning over. That's why we use antioxidants, because oxidative stress means as our bodies go through the normal metabolism to reproduce, they produce they produce agents that need to be, that can disrupt the cells of the body, the lining of the heart, the lining of your blood vessels. We now know there is a relationship between telomeres length and age-related conditions. This is one of the reasons why people use resveratrol, that is the phenol that's in red wine, because we know that there it does in fact induce a set of genes that can affect telomeres. I'll just leave it at that. This slide I want to share with you because this is so important. Prostate cancer. There was a study that was done that looked at, if you look at the bottom, in collaboration with Dean Ornish, she's old school but has been doing work that's been highly valuable for years. They looked at comprehensive lifestyle intervention in patients who had prostate cancer. And if you'll look on the bar graph on the right, with the lifestyle intervention, 6 weeks, exercise, going to a plant-based diet, mindfulness, stress reduction, look at the blue. Their telomeres grew. Just realize that that positive directions meant they lengthened their telomeres, which is lengthening life. There was a reduction in the control group. The same thing with dementia. Again, healthy controls in the first bar, dementia, the third bar. Again, telomere length is important. Same thing in cardiovascular disease. Here's what's important. You can control aging, the component that's related to telomeres, by a balanced diet with antioxidants, reducing your stress, and lack of alcohol abuse and drugs, which should be pretty obvious. But the fact that we now have these associations, I think, is huge. The number one component for a healthy lifestyle is maintaining a healthy weight, and we can do that with exercise. Again, 2.5 fold increase in telomerase in young athletes. So important. It increases as we get older as well. Exercise matters. And again, just threw this in for humor. I'd taken care of myself if I had known I was going to live this long. So let's take a look at just 3 disorders, and then we're going to go for about another 5 minutes, and then we'll take questions at the end of this. Heart disease was a real problem. We talked about it. What I want to focus on here is your heart age. There's a website I'd invite everybody to go to. Again, data for someone if they really have questions, how do I get started? I'll go to the next one. And that is, it's called Heart Age. If I can show you that slide. There we go, at the bottom. It's called cdc.gov, heart disease /heart age. Your heart, again, number 1 cause of death all over the world. So in developed countries. 45 years old, even though he might be 45 years old, his heart age would be 75 if he's a smoker. Systolic blood pressure of above 150, even though he had a healthy BMI. But he's a diabetic and doesn't necessarily keep his sugars under control. And what are we talking about in terms of your, why is this important? Let me just share this with you. What causes a heart attack? Think about it as that paste that you had in those jars of glue that you used when you were in elementary school. That's what the yellow is on the right. So if you take a look at these slides, you develop that and you have inflammation inside of your blood vessel along with the buildup of those low density lipoproteins. See up there it says LDL, far left graphic. So those low density, okay, they're small, so they get into the blood vessel, they build up, and they cause a plaque. And at the very bottom right, it becomes a clot, which can then rupture, again, progression of coronary artery disease, and cause a stroke. And if you have a heart age that is greater than your chronologic age, and you have an unhealthy lifestyle, you're more likely to have a heart attack. I don't want to go into this in detail, but if you do, in fact, if you have chest pain with exercise, if you've had a heart attack or stroke, if you have a client who's had that, they need to have a conversation with their doctor about whether or not they should be on a statin. I'm not advertising it. I have no interest in it personally. There's some controversy about the use, but the fact that anybody with diabetes over the age of 40, they should have that conversation with their doctor. That's something you can do today that would make a difference. I'm going to say a couple of things about cancer. The American Cancer Society came out with new guidelines in November. I just wanted to share them with you. And again, American Cancer Society has guidelines, and then the U.S. Preventive Services Task Force, again, that same task force that came out with the new guidelines for depression. Here's the point. No screening by the Preventive Task Force recommended before age 50. However, now the Preventive Task Force is aligned with, for good or bad, reimbursements. So you may notice some trends in how that works, right? So they're saying nothing before 45. American Cancer Society back in November now said age 45, assuming you're a normal risk, not if you have first-degree relative, aunt, mother, who has had breast cancer. Then every other year between age, so again, 45 to 54, and then after that, every other year. Yearly till 54, every other year after age 54. Another comment I want to make, this comes up often, ultrasounds are not useful on their own. Obviously, it's uncomfortable to have a mammogram. However, it does not pick up microcalcifications, which can be early evidence of cancer. I will not go through the details of this. No one should be dying of metastatic colon cancer, but I see it every day. Age 50, you need to find a way to get that done. Partner with somebody, think about it, ask your clients. Unintentional injuries, again, clients who are younger, who are doing risky things because they can afford to do it, please have that conversation with them about thinking about that risk before they do it. Stroke is important to think about. The risks that are there for heart disease, it's just a difference of the vessels of your brain leading to your brain and your heart. And then finally, I want to talk about how we pull this all together for a client and for you, for us, to work with your families. My premise is if you can integrate values, fortify, we think of fortify, what do you think about? You think about fortify something to make something stronger, to invigorate it. I would say that each of us and each of our clients needs to be thinking about, is there a baseline level of wellness for all family members? Have you talked about it? Is there a conversation? Is there a comprehensive medical history for the family? Not just 23andMe and you want to know something about who you looked and where you came from, but more importantly, what does wellness look like for your family? What are the chronic disorders that you could make a difference for? Our organization, the Scott Advisory, put together a wellness charter for families. And then if someone financially is to a point where they need to decide if a trust is going to pay for certain types of wellness concerns. Family health portrait, you can go online. I would not suggest putting my personal health and wellness online, but the government does have, you can use it just to understand it. There's a tool for you to have your personal family history, and that's a great thing to pass on to your children, to be able to understand what are their risks, similar to, of course, the story of Angelina Jolie and what she did. And of course, because of epigenetics, we know if you change your genetics sometimes, you will also change the lives of future generations because of epigenetics. And again, it's establishing that family culture of wellness. One of the things you can do is have everybody at a family event just to check your weight. Just do a weigh-in. Say, okay, we're going to have a family event, a party or a gathering. There's a scale over there, and everybody write it down. And again, the core. Okay,
Sorry.
all right.
I can imagine that could be an extremely threatening party. Yeah, most families.
All right. Okay, all right. But
you're going to do that the day after Thanksgiving, right?
Right. And it has been described that the David would look like the image on the right if he were what was considered the average weight now. This is an important point. When we think about being obese, too, we talk about the apple shape versus the pear shape. What's on the right, look at on the normal individual with the BMI, this is on the right. What's white on the inside is fat. The obese person just has a BMI of 32, and I want you to think about that. Up to 25 to 29 is normal. You're just obese up to 30. You're obese beyond that, or overweight and then obese. But that fat becomes its own independent endocrine organ. It's going to affect your body in terms of inflammation, in terms of lack of flexibility of those blood vessels. And here are the last final slides. So what are the recommendations? I love Michael Pollan's work. I went to the Culinary Institute of America in Greystone and had lectures from experts about health and wellness, and read this book. I love this. These 8 words: eat real food, not too much, mostly plants. Another concept, anti-inflammatory diets, because we know when I showed you that thrombus in that blood vessel, that clot, inflammation is what triggers ultimately. Perhaps we're thinking that clot dispersing itself and causing an occlusion of the flow of blood, which leads to the, quote, heart attack. Occlusion of the blood in the vessel in the brain, going to the brain, causing that stroke. So we're talking about an anti-inflammatory diet. Again, low and simple carbohydrates. What do I mean by that? Using carbohydrates that don't give you the sugar high. And here's the other thing that happens when you have a high glycemic index, meaning simple sugars, sugar versus something like broccoli, which is slowly digested, low glycemic index. Guess what else happens? The reward places in our brains are turned on when we have that soda or those high glycemic index foods. which is why the food industry knows it. They put it in those foods, and therefore you end up wanting to eat more and more of it. Again, low inflammatory diet. Another thing that's a low inflammatory diet is just caloric restriction. As we get older, because we have less muscle mass is what takes most of the energy and metabolism. If you have less muscle mass, you need fewer calories. You reduce your calories by 30%, there's a 30% increase in your lifespan, it's projected. So again, low inflammatory diet. Physical activity, there is a whole new movement about this. Exercise is medicine. Ask your doctor. You are the CEO now. Ask your doctor for an exercise prescription. Guidelines exist. Physical activity includes all of these. You know about them. And finally, stress reduction. Pausing your mind. Stress used to be yesterday, lions and tigers and bears. And we know now it's so much more. It's that email. It's that travel. So what I want you to think about, what Robert Sapolsky wrote about so well, zebras don't get ulcers because our body's hardwired to respond to stress on the savannah, run, deal with the stress, and your body goes back to its normal. It shuts down all unnecessary functions, sharpens your senses, your eyes, pupils get big, lessens sensation of pain. That's what happened when you're a zebra, but that's not what happens to us. We have triggers. We have life events, disruptions in our life, that car accident. We have disasters. We have chronic disparities. And the responses are our thoughts, our biology, our behavior, and our emotions. So one other point that I just wanted to bring in for leaders specifically. This is a study that was done specifically looking at metal industry employees, but the British government has done it. Several places have looked at it, and the person who's done the most is the gentleman who's up at the University of Massachusetts, who has looked at the demand and control. We know, and this is for the CEOs and for entrepreneurs, perceived lack of control, high job demand, and a disparity between effort and reward, and a perception of threat rather than a challenge. Those are the situations, and I could show another graphic that would show that unfortunately it's not quite as straightforward as it would appear, because of course if I don't have control of my life, I'm putting widgets in a hole, I'll be stressful. Not so. Those low-line factory workers, respectable people doing their job, they're not going to die of a heart attack. The reason we do it is because we've got control. But because we have control, we say, oh yeah, I can push through it, I can do this, I can do that. We get to the point we're not even aware of the fact that even though we're in control, we truly are not taking control, which is the whole concept of really being the CEO of your wellness, setting that vision, taking control so that you can, and on a conscious level, know what's going on with your health. Beautiful. Again, what I invite people to do is to be in your best stress zone, which is what the first book that I wrote, where you are having that optimal stress, recognizing that stress is inevitable, but you're flourishing. You're able to recover. You don't have that persistent hostility, where you're in that flow zone that Mikhail wrote about, the book Flow. And I want you to think about it. Relax, reflect. Relax, reflect, and accept. So, having said all of that,
we're going to need to wrap, but I'm sure everyone is filled to the brim with this amazing information. Unfortunately, we don't have time to take additional questions, but I will ask you if you're okay with follow-up questions. People may want to follow up specifically with you about any of the specific slides or data that you shared. Are you okay with that?
Absolutely. And the slide here now, Dr. Scott.
What's the best place to, is that up now? I'm not looking.
Right, it is. It should be, yes. Dr. Scott at thescottadvisory.com. That's the name of my company. And my phone number, I'll just say that, 410-336-7894, 410-336-7894. And of course, for any of my colleagues who are part of this organization, more than happy to answer questions, give more data, and I appreciate your attention.
And we appreciate your taking the time, especially to give us a framework, research, and a whole lot to think about in terms of what we can do better for ourselves and for our clients. So I want to thank you, Carol. I want to thank all of you for being attentive and staying engaged. And please do feel free to write to me at the Institute or directly to Carol if you have questions and want more information about any of the slides that she shared. And all of you, we look forward to seeing you again next month. So take care. Enjoy. Bye-bye.
Thank